All right, everyone, get ready, because today we are going deep on something really incredible, and that is the menstrual cycle.
Wow.
We've got tons of research, and I think you are going to come away with a whole new appreciation for what your body does every single month.
I love it.
And yeah, get ready to kind of ditch all of those old ideas about, that time of the month, because it's a lot more fascinating than maybe we've given it credit for in the past.
It really is, yeah. The menstrual cycle is one of those things that we often oversimplify, and we don't really get into the details of what's going on, and it's really, really remarkable.
Yeah.
It's not just about bleeding, it's about all of the things that are going on behind the scenes, like this beautiful orchestration of hormones that's going on and affecting your whole body, not just your reproductive system.
Yeah.
But it's a sign that things are working the way they should be working.
Right, exactly. So before we get into all their really fascinating details, let's just start with the basics.
Okay.
What exactly is menstruation?
Yeah, so I guess the simplest way to think about it is that the lining of your uterus is like a comfy nest and it's getting prepped for a possible pregnancy, right?
Mm-hmm.
And if an egg doesn't get fertilized, then your body is like, okay, well, we don't need that cushy lining anymore, and so it sheds, and that's what we call menstruation or a period.
Okay, that makes sense. Now, I always kind of thought of it as this like rigid 28-day cycle,
Right.
but our research suggests that it's not that simple, is it?
No, it's not. While the average cycle is about 28 days, it can actually range anywhere from 24 to 38 days.
Wow.
And very few women will have a perfect 28-day cycle every single month.
Right?
So your body really listens to its own rhythm.
Yeah.
And that can be affected by things like stress or even changes in your weight.
Oh, interesting. So we're not all like ticking like perfect clockwork.
No.
That's kind of a relief to hear, actually.
Mm.
So, and to make it even more interesting, there are actually distinct phases within the cycle, right?
Yes, exactly. So we have the follicular phase, the ovulatory phase, and the luteal phase. And each one of them is driven by these really specific hormonal changes that create this cascade of events in your ovaries and your uterus.
Wow.
It's really
So
fascinating.
it's like a cycle within a cycle.
Yes,
Yeah.
exactly.
Well, let's break it down then, phase by phase.
Yeah.
What's happening during the follicular phase?
So this phase kicks off on the first day of your period. So think of it as like the getting ready phase, right?
Okay.
So estrogen and progesterone levels are really low at the start, and that's what triggers the shedding of that uterine lining we were talking about. But then your pituitary gland releases follicle stimulating hormone, or FSH.
FSH, that's the one
Yeah.
that kind of gets things moving.
Yes, exactly. So FSH is like the talent scout, right? It's
Yeah.
looking for the best egg to mature for this cycle.
Okay.
And it actually stimulates the growth of several follicles in your ovaries. And each one of these contains an immature egg.
So it's like a competition to see which egg gets to be the star.
Exactly. So, and then one follicle will become the dominant follicle, and that will continue to grow and it'll produce more and more estrogen. And this sets the stage for the next big event, which is ovulation.
Okay, I'm excited to hear about this. Tell us about the ovulatory phase. This is where things get really interesting.
So this is when that carefully selected egg, right,
Yeah.
makes its grand debut. The rise in estrogen that we were talking about, it triggers a surge in another hormone called luteinizing hormone, or LH.
Okay.
So you can think of LH as the grand marshal giving the signal for that dominant follicle to release its mature egg.
And that is ovulation.
Yes, that's it.
Wow, I've heard that I heard that some women actually feel it happening.
Yeah.
Is that true?
It is. So some women, when that egg is released, they'll actually feel a slight twinge or maybe a little discomfort on one side of their lower abdomen.
Oh, wow.
It even has a name. It's called Mittelschmerz, which literally means middle pain in German.
That's so interesting.
But it's usually nothing to worry about and can actually be a really good sign that ovulation is happening.
Interesting. So the egg is released, it's ready to be fertilized. What happens next?
So then we enter the final phase, the luteal phase.
Okay.
So after it releases the egg, that empty follicle transforms into this structure called the corpus luteum.
Okay.
And this little powerhouse starts pumping out progesterone.
Progesterone, another key player in this hormonal symphony.
It is, yeah. It really is.
What's its role in this phase?
So you can think of progesterone as like the interior designer, right?
Mm-hmm.
It's prepping the uterus just in case a fertilized egg arrives. So it's thickening the lining, making it a really plush, nutrient-rich environment for that potential embryo to implant.
So if estrogen is all about getting the egg ready, progesterone is making sure that the uterus is like the perfect welcoming committee.
Exactly.
Okay,
Progesterone also causes your cervical mucus to thicken, and that creates a kind of barrier to protect the uterus from any sperm or bacteria.
that makes sense. But what happens if the egg isn't fertilized during this phase?
So if fertilization doesn't happen, then that corpus luteum sadly fades away.
Ah,
Yeah, and then this leads to a drop in both estrogen and progesterone, and that signals to your body that it's time to start shedding that uterine lining and brings us back to the beginning of a new cycle with menstruation.
oh, wow. It really is like this perfectly choreographed dance of hormones.
It really is.
It's incredible. You mentioned earlier that estrogen levels are high during the luteal phase.
Yeah.
Does that have any noticeable effects on the body?
It does. So high estrogen along with the rising progesterone can lead to some of those familiar premenstrual symptoms like breast tenderness or bloating.
Right.
And some women also experience mood swings during this phase, which is totally understandable given the hormonal roller coaster that's going on.
So it's not just about the physical changes in the uterus.
Yeah.
It's a whole body experience.
Yeah.
And this seems like a good time to talk about variations in the menstrual cycle. Because we've established that the average is around 28 days.
Right.
But what about those of us who experience some irregularities?
Right. Well, it's really important to remember that variations are really common. Not every woman experiences a perfect 28-day cycle, and that's totally normal.
Okay.
So things like stress, weight changes, and even certain medications can influence the cycle length and how regular it is.
Got it.
Yeah,
So if your cycle isn't like a perfect textbook example, you're definitely not alone.
definitely not.
But when should someone consider seeing a doctor about their cycle?
Well, I think it's always a good idea to consult a healthcare provider if you experience any sudden or drastic changes in your cycle.
Okay.
And especially if you notice any unusually heavy bleeding, prolonged periods or any severe pain.
Okay.
Because while most irregularities are benign, it's always best to rule out any underlying medical condition.
That's reassuring to know. I think it's empowering to understand what's happening in our bodies and to know, okay, this is when it's time to seek professional advice.
Exactly. Yeah. Knowledge is power when it comes to our health.
Right.
And understanding how intricate the menstrual cycle is can really help you manage your symptoms or plan for family life and just advocate for your own well-being.
Couldn't agree more.
Yeah.
Now, before we move on to the next part of our deep dive, I want to talk about some practical tips for taking care of yourself during your period. What are some things we can do to ease those pesky symptoms?
Yeah, I think a lot of it comes down to just simple lifestyle changes and remedies that are readily available.
Okay.
So, for instance, incorporating regular exercise and stress management techniques, things like that can really help regulate those fluctuating hormones and help with the mood swings.
Right.
And for those cramps that just won't quit,
Yeah.
over-the-counter pain relievers like ibuprofen or naproxen can be really helpful.
Those are good tips, yeah.
Yeah.
It's amazing how much we can actually do to kind of support our bodies during our periods.
It really is.
Let's talk about menstrual products.
Okay.
There are so many options these days.
There are.
What are some of the most common ones?
Yeah, you're right. It's like a smorgasbord of choices out there.
It is.
And it really boils down to personal preference.
Yeah.
And what feels best for you.
Right.
But I think some of the most popular options, obviously we've got the pads, which are those absorbent materials that you wear in your underwear. And then there's tampons, which are inserted into the vagina to absorb the flow internally.
Right.
And then in more recent years, menstrual cups and discs have become increasingly popular.
Yeah.
And these are reusable, flexible options that are also inserted into the vagina.
Well, there really is something for everyone.
There is.
What advice would you give to someone who is trying to figure out what's best for them?
I think it's all about experimentation.
Okay.
Trying different things out, seeing what you like best. It might take a little bit of trial and error. But I think really think about, your flow, your lifestyle, and any kind of sensitivities you might have.
Okay.
So, for example, if you're super active, tampons or a menstrual cup might be a good choice.
Right.
If you have sensitive skin, maybe you want to go with organic cotton pads or those reusable options.
Yeah, that makes sense.
Yeah,
It's all about finding what works for you.
it really is.
Let's talk about a topic that can be a bit sensitive.
Okay.
Heavy bleeding.
Yeah.
When does it become a concern and what can be done about it?
So it's normal to have some variation in your flow throughout your period.
Right.
But if you're consistently soaking through a pad or a tampon every hour or two,
Wow.
or if you're passing large clots, that's definitely something you want to talk to your doctor about because there might be an underlying cause that needs to be addressed.
Right.
But the good news is there are a variety of treatment options that range from hormonal medications to even minimally invasive procedures.
Okay.
So, don't hesitate to seek help if you're concerned about that.
Good to know. Yeah. It's reassuring to know that there are options available.
There are.
I want to shift gears a bit and talk about the emotional and psychological aspects of the menstrual cycle.
Okay.
We talked about the hormones and their impact on our mood,
Yeah.
but what about the broader cultural and societal perspectives on menstruation?
That's a great question. And it's actually a topic that deserves a whole separate deep dive.
Yeah.
But unfortunately, menstruation has been surrounded by stigma and taboo for way too long.
It's true.
And in many cultures, it's still seen as something to be hidden or even shameful, which can have a really negative impact on women's self-esteem and their mental health.
It's so sad that something so natural and essential to women's health has been burdened with so much negativity.
It is.
What can we do to challenge these harmful perceptions?
Well, I think it starts with open and honest conversations, like the one we're having right now.
Right.
By educating ourselves and others about the menstrual cycle, I think we can really help dismantle some of those myths and misconceptions and create a more positive and accepting attitude. And it's also really important to advocate for better access to menstrual hygiene products and education for everybody.
Yes.
Making sure that all women and girls feel empowered to manage their periods with dignity and confidence.
Absolutely, yeah. Knowledge is power.
It is.
And by bringing these topics into the light, we can create a more supportive and understanding environment for women everywhere.
Exactly.
We've covered so much in this deep dive, from the intricate biology of the menstrual cycle to the societal perceptions that surround it.
It's been an amazing journey, hasn't it?
It really has.
We've explored this incredible hormonal symphony that drives the cycle and the variations, which are totally normal, and the importance of self-care and knowing when to seek advice.
Right.
And we've also highlighted the need to challenge the stigma around menstruation and create this more open and accepting dialogue.
Yes.
Yeah.
Before we move on to our final thoughts, is there anything else you think our listeners should know about taking care of themselves during their period?
Let me think. Any extra tips or advice? I think beyond all the practical tips we've talked about, one of the best things you can do is just listen to your body.
That's so important.
It really is. Rest when you need to, nourish yourself with healthy foods, and be gentle with yourself.
Yeah.
Your period is really a time for self-care and honoring those incredible things that your body can do.
That's such a good point. It's so easy to forget that sometimes, to just slow down and listen to what our bodies need.
Yeah.
Now, before we wrap up our deep dive, I want to circle back to something we touched on earlier.
Okay.
This idea that the menstrual cycle isn't just a biological event, but it can be, for many women, a deeply personal and even spiritual experience.
Yes, absolutely. And there's this growing movement to reclaim the menstrual cycle as a source of power and wisdom.
Yeah.
And a lot of women are starting to explore the connection between their cycles and their emotions and their creativity and their energy levels.
That's so interesting.
And some are even using cycle tracking methods to align their activities with the different phases of their cycles so they can tap into the unique energy that each phase has to offer.
That's fascinating. It makes sense.
Yeah.
Our hormonal fluctuations would influence not just our physical state, but also our mental and emotional landscape.
Oh.
It's like having this internal compass
Yeah.
that can guide us if we just learn to listen to it.
Exactly. And by becoming more aware of our cycles and how they impact us, we can actually use that knowledge to live more in tune with our bodies.
Totally.
So, for example, during the menstrual phase, when your energy levels tend to be a little bit lower, that might be a time for you to just rest and have some introspection, right? Whereas the ovulatory phase, with all that estrogen surging, that might be a great time for socializing or, putting yourself out there.
Yeah, it's like each phase has its own superpower that we can tap into.
It really does.
This brings us to a really important point, I think, which is the need for more open and honest conversations about menstruation.
Yes.
Not just the biology, but also the personal experiences and meanings that women attach to it.
I couldn't agree more. I think for too long, it's been something that's been kind of shrouded in secrecy and shame.
Yeah.
But By talking about it openly and honestly, we can start to break down those taboos and create a much more positive and empowering narrative.
Hmm.
We need to move away from this idea that it's something to be hidden or whispered about
Right.
and really embrace it as a natural and even sacred part of being a woman.
It's time we reclaim the narrative and really celebrate the power and the wisdom of the menstrual cycle. It's not just about bleeding, it's about creativity, intuition, resilience, and the cyclical nature of life itself.
I love that. Beautifully said. And I think that's a perfect note to end on.
I agree.
Thank you for joining us on this deep dive into the menstrual cycle.
Yeah, thanks for being here.
I hope you've learned a lot about this incredible process and you feel a bit more empowered to embrace your own cycle with knowledge, curiosity, and self-compassion.
And to all our listeners out there, we encourage you to keep this conversation going, share your thoughts and your experiences and your questions with us on social media. Let's keep learning, keep exploring, and keep celebrating the amazing power of the female body. Until next time, stay curious.